So, hello, we are going to review the consultation model. So for that, whenever the vitals are captured and there's now a need to perform the diagnostic, that means that the doctor now sees the patient. He or she should be able to record her his or her assessment. So for that, all you have to do is to go to start consultation doctor. So if you are a doctor or a physician assistant, then you are presented with this form. So what you have to do next is to search the patient by name, either first name or last name. So I have a dummy patient here that I've created, so I'm going to use the details. So what you have to do then pay attention to is the date of consultation. Because what usually happens is that whenever vitals are entered, that's when the consultation record is created on the system. So let's take an example. Let's say today is 8, 8, 8, 8 May 2023. We are going to select this. Ideally, you should have one record per day, but since this is the dummy, the test environment, I made multiple records for testing purpose. So what you usually see is that you see the name of the patient on the far left, in the middle, then you see the patient's ID, then you see the dates of visits, right? So you have to select the dates that you want to review. So let's say we are reviewing today being the 8th May 2023. So what we have to do is to press on prescribe, right? So what's going to happen next is that on the first form, you are going to see the vitals that were captured earlier. So mostly these are vitals that were captured by the nurses, right? So you should be able to see those on the first page. Now, after that, what you have to do next is to enter the details. So, for example, I'm Dr. Ephraim, and I'm the primary care physician. So the primary care physician is basically the person who usually sees this patient, right? So if it's you, you put in your name. If it's another one, you put in your name. And now the consultative physician is a physician who is actually seeing the patient, and the two can be the same, right? And a consultation reason could be, for example, for general checkup, and from presenting complaint, you don't record the presenting complaint of the patient. So let's say having headache since yesterday or something, using the medical terms. And for the history of complaints, you can also put that, like for example, had fever in the last months. I mean, these are just rather information. So had stomach ache. So you just put in anything that you feel should be in the history of presenting complaint. So after this, you then save and proceed to the next stage. So after that, you are now brought to the form where you do your own direct questioning, right? So for the on direct questioning, it's done in two ways. You already have the template that allows you to enter your details for the on direct questioning, and this is done as you can see. So for the pre-filled template, you can just indicate, for example, if the patient has fever, yes. Does he excessively sweat? You say no. If there's a weight of loss of weight of gain of weight, you indicate it. Otherwise, you can leave it at now. So I'm just putting something. And if the person has headache, you indicate it. Otherwise, if you don't know, if the person has chills, rigor, and if there's any other note that you want to provide. So after that, you create it. So what happened was that you've created now the answers to the direct questioning based on this general format. Now what you can do is also to formulate questions on your own as well as provide the answers to the question. So basically this is a questions that are not covered in this template, right? So this is just an example. I, if I ask the patient, have you slept during the have you slept at least, I know this is not accurate, but just an example, at least 8 hours last night, and the patient say no, then you record as such and you create a record for it. So what happens was that everything that you create is saved, as you can see here. So together with the general direct questioning, there are also specific questions that you can formulate and provide the answers to. So after that, we go to the systemic inquiry. So for the systemic inquiry, it has to do with the nervous system, different systems of the human body. So for that, you have the cardiovascular, you have the respiratory, you have the gastrointestinal, you have the genitourinary, you have the musculoskeletal, the central nervous system. So just for you to edit and provide the answer. So for this, as you can see, the form is protected. You always need to click to unlock and provide your answers accordingly, right? So you just provide your answers accordingly. So looking at the cardiovascular, you indicate if he or she, the patient, had the chest pain, palpitation, shortness of breath, PND, orthoponia, syncope. So you just provide all the answers. So this is what you are going to do for every system. To the respiratory, all the components, you just indicate it. Where you are not sure of, you leave unknown. If there are any other, there are boxes that are for the others in terms of any comment that you want to put under each system. For the gastrointestinal, you do the same thing. You indicate where relevant, as well as the genitourinary, where you even here indicate, for example, the color, the menstrual patterns, the itchy vulva, and all those things. So these are just things that you need to go through, and wherever relevant, you indicate it. Then you go to the musculoskeletal, and you indicate just like it. Where there's pain, you say yes, no, swollen joints. Then you go to the central nervous system, you also indicate the same, right? And you do so all the way to the end, right? So after you're done with everything, all you have to do is to press on update. So when you press on update, you've actually edited your assessment. So after this, we now go to the histories when you click on the next button. So for the histories, all you have to indicate here is, for example, the past medical history of the patient. You have the box, so you can indicate anything, right? So that's, for example, I say that I had a severe accident 5 years ago or something. Past surgical history, maybe you can say that I had a surgery 5 years ago on the lower limb. I mean, you just put in your medical things, medication history, as well as social history and everything. So when you are done with everything, you click on save, right? You click on save. After you click on save, it takes you to the examination side. So for the examination side, what you have to do is to put in your answers based on the examination that you've done for all the and again looking at all the systems. So you can put details for general, you can put the details for cardiovascular in a free box, as well as respiratory, gastrointestinal, central nervous, genital system, musculoskeletal, as well as others. So once you are done with it, you can click on submit, right? Otherwise, if you don't want to fill it, you can also click on next, right? For your impression, based on the assessment that you need, you can now put in whatever expression that you have, and that one is on the form in the box. So you just enter maybe your impression of that. Maybe he needs some labs, right? So it's just a free flow. So it's either you save it or you go to the next. When you go to the next, that means you are skipping it. But if you are inputting something in the box, you always need to click on save, right? So by clicking on save, it always takes you to the next place. Now, what happens here for the labs is there are two ways of requesting labs, right? So for the labs that are internal, that means that the labs that are available in the facility, you can start searching them, right? So here, I search the labs by their names, right? So if, for example, I want to administer a malaria test, it's available. So all I have to do is to click and on request. So when I click on request, what it's going to do is that it's going to send the request to the lab technician, right? So that he or she can perform the lab test, right? So that is it. So after you click on request, it will be loaded. So now, what happens after this is that if you want to, for example, have input some lab requests, especially for those that should be done externally or those that should be kept on the file, you have a box where you can enter all those details, right? So for example, if you say you want the patient to do maybe some, let me think of something. Okay, so maybe some advanced test that is not available, you just put in the details. So maybe perform, let me just write advanced tests because it depends on you and your assessment. Maybe on urine. And you give your indication so that what is going to happen is that whatever you are inputting in this box will be on the patient's file, right? And click on submit. So after you click on submit, everything loads. So yes, this is what you have